My name's Hector Glenn. I'm the president and CEO of the Village for Family and Children. And we are honored to be here today with behavioral health experts, community partners, and champions for wellness. Here today, we have our partners from CCMC, a client who has gone through some of the village services, the behavioral health advocate, Howard Skravansky, DCF Interim Commissioner, Sue Hamilton, DSS Deputy Commissioner, Chantel Vars, and our Chief Medical Officer, Dr. Lane Taylor. Today we're hosting this event because school has just started, and school should be an amazing and exciting time for children and families, but it's not always that. What we see in the numbers year after year is that this is one of the most stressful times for children and families. And we, as a community and partners, wanted to make sure that every family member knew of the resources that are available to them. So with that, I'd like to ask Dr. Taylor to step up and share some words.
Good morning. Thank you everyone for coming. This turned out to be a nice fall day. As Hector mentioned, this is supposed to be a really exciting time, right? You have kids going back to school, the experience of being able to see what the new year holds. But what it is really is a transition. And for some kids that can be exciting, but for other kids that can be anxiety provoking. That can cause a lot of stress and kids to feel overwhelmed. And so as a result, you have children who struggle with this transition and seek support and help. If it's, our kindergartners who are starting school and struggling with being apart from their family, or it's our teenagers going into high school and they're struggling with the overwhelming next steps of applying for college or their homework or what's required of them within their classwork. Kids seek more support while they're at school, and in fact, school is the first place that they typically go for that help. 70% of children seek behavioral health support in the school setting. And it's usually the first touch point of access to any behavioral health care. Our kids are going to their teachers, counselors, and principals and asking for help when they're in distress. Our schools are not just places for learning, they're lifelines. So it's important to highlight that there are resources that are available as our kids are going through increased stress and difficulties. And one of the resources I really want to highlight are our urgent crisis centers here in Connecticut. There are 3 community locations across the state that are available with just walking in, no appointment needed, in order to provide immediate support for our children and teens who are experiencing emotional or behavioral distress. Whether it's because of anxiety, depression, thoughts of self-harm, or they have out-of-control behaviors, children are able to come to our urgent crisis centers. They can drive in, they can walk in. We also have access to ambulances that can transport to the urgent crisis centers as a means of being able to safely transport the children. A multidisciplinary team will be immediately available to provide crisis stabilization, mental health assessments, and connections to ongoing care. So let's make sure we're committing, as our kids are going through this transition, to supporting and checking in on our kids. Not just about their homework, but about their hearts. Let's model healthy coping strategies. Let's build predictable routines and stay alert to signs of struggle. And let's remind every child in Connecticut, you're not alone. Your feelings matter, and help is on the other side of these open doors. Thank you. I'd like now to pass it on, or yeah? Okay. I'd like it now to pass it on to Dr. Rogers.
You guys hear me okay? Good morning. I guess still good morning. And thank you for having me here to speak about our children's mental health and the urgent crisis centers. My name's Steve Rogers. I am a pediatric emergency medicine physician at Connecticut Children's and the medical director for our emergency behavioral health services. As our kids return to school, as Dr. Lane pointed out, they will have to adjust to new routines and experiences that can lead to increased stress and anxiety. And some kids will struggle with difficult mental health problems. We know 1 in 5 children who come to our emergency department at Connecticut Children's will screen positive for suicide risk. That's right, 1 in 5 kids who are seen in our ED screen positive for suicide risk. And that's throughout the year, so this time of year is even more challenging. By asking suicide questions, we identify approximately 2,500, yes, 2,500 kids a year who are struggling with suicidal thoughts and behaviors. So by doing that, we can ensure a timely evaluation, connection to care, and ultimately we save lives by reducing suicide attempts. Many of us as parents fear that talking about suicide may put those thoughts in our children's heads. But research shows it's safe. Again, I'm going to say that again. Research shows that it is safe to talk to our children about suicide, and actually helpful to ask directly about suicidal thoughts. By talking about suicide with our kids, we can provide a sense of hope for those who are struggling. That principle is central to the work of our newly launched Youth Suicide Prevention Center. The center is dedicated to reducing youth suicide through early identification, education, and community outreach. And we know that to be successful, we need to collaborate with our community partners. And we all are familiar with the phrase, "it takes a village." Yes, pun intended. In this case, that includes partners like the urgent crisis centers here at the village to ensure families are connected to the right resources at the right time. If you're worried about your child and their mental health, or feel they're having a mental health crisis, we encourage you to call 988. They'll help you figure out next steps, like going to an urgent crisis center or even the emergency department. So together, we can build a more effective and compassionate system that will support our children's mental health during these and other stressful transitions in life. Thank you. And next, I'd like to introduce Howard Savronsky, our state Connecticut behavioral health advocate.
Thank you. Good morning. My name is Howard Savronsky. I'm the new and first Connecticut State Behavioral Health Advocate. The Office of the Behavioral Health Advocate was recently established to promote and improve access to care for all those in our community who are seeking behavioral health support. Successfully navigating the behavioral health system has been an ongoing challenge, only highlighted by the current behavioral health crisis. But informing our community of needed resources, of creating options for families and their children, are critical in creating a more responsive system of care. Prior to assuming my role, I had the honor of serving as Chief Behavioral Health Officer at Connecticut Children's, along with my friend Dr. Rogers. I had the opportunity of visiting the emergency room on many occasions and seeing the faces of children who are coming there seeking help for their emotional turmoil. And I got to tell you, it was heartbreaking. Connecticut Children's continues to be the leading provider of emergency behavioral health services for children and adolescents. But as you know, it's been reported that our emergency rooms continue to be overutilized and frequently overcrowded. While they do an amazing job, we know that most kids who present at our emergency room are quickly discharged because they do not need that level of care. But for many, they need a different level of care, such as that is often offered by our urgent care centers. Long before the pandemic, we saw a disturbing increase in emergency room utilization, which demanded our collective attention. We needed to find an alternative for the growing number of children who are in crisis. Today, we recognize that what can be done when organizations like the Village and Connecticut Children's, along with their partners in the legislature, in government, join together to find innovative solutions to the critical problems facing our families. We can now confidently say and offer that our children now have an alternative, a place where they can go, get the right level of care at the exact time they need it, in a setting that's specifically designed to meet their unique needs. The children's behavioral crisis is not over. But creating a continuum of care as demonstrated by the collaboration between the Village, Connecticut Children's, is one of the many ways we are beginning to tackle the many challenges before us. This model works and deserves our ongoing support to ensure that it remains an integral part of the system of care in Connecticut. Thank you. Now I'm introducing, DCF's Interim Commissioner, Susan Hamilton.
Thank you. It is still morning. Good morning, everybody. I wanted to just echo first DCF's sincere gratitude to all of you for coming here today to raise awareness about this very important, not only behavioral health crisis that we do find some of our kids going through at the moment, but also to thank our partners, our sister agencies, our providers, Hector, for inviting us to participate in this event today to raise that awareness so people know where to go when their kids are in crisis. I also wanted to echo thanks to our legislative partners, the governor's office, and others who have really lifted up this new initiative. I just stepped into the DCF commissioner seat a week ago, so there's that. So, but I do like to start by saying I started as a frontline social worker over 30 years ago, and I have seen and stayed in the field of child welfare over the course of those 30 plus years, and I have seen it myself personally and through the folks that we serve through our department, the acuity and the need that kids have for behavioral health interventions escalate for a whole host of reasons, I think. But the ability for the system and the state to evolve and to identify new and different ways to provide support and access in a way that is more immediately available and more tied to the individual needs and circumstances for the children and families involved. And this is an initiative that it's 2 years old now, I want to say. But we're seeing, as the previous speakers have indicated, very, very good outcomes and experiences for the kids and the families that have been served by the program so far. I may be echoing a little bit what other folks have already said, but the beginning of the school year, obviously this is National Suicide Prevention Month. The level of need and demand and the challenges that kids face, I think, oftentimes escalate right at the beginning of the school year. And so this is perfect timing to also continue the efforts that I think the media as well has helped us to try to inform people about how to best access these services. Again, their availability is broader than what some of the more community-based programs have had available in the past, and have prevented the need for families to have to take their children to emergency rooms. In some instances, that's necessary, right? For if kids are in an immediate crisis and 911 is the only the immediate option that you need due to the level of emergency that the child's experiencing, that's obviously continues to be, right, an appropriate intervention. But for kids that need something different than that and avoiding the need for an emergency room visit, going to the UCCs has given rise to better supports, different supports, more tailored supports, and ultimately better outcomes. I think there may have been some data points shared already with regards to what we're seeing, but the average time that kids and families are having to spend in the center is much lower. On average, about a little over 3 hours when kids are presenting to and being assessed at a UCC versus perhaps longer lengths of time in emergency departments, but more importantly, the ability to then discharge or serve the child and return them back home to their community, having had that proper assessment, is something that is unique to the UCCs. 97.5% on average of the kids are returning home, and they're going back to their communities and being with their families. And 52% or more our families have reported that they would have had to go to the emergency room had this service been unavailable. And I think a real significant percentage or data point to highlight is that 95% of the kids that are served end up being better off, right? They have improved outcomes and their condition has improved following their visit to the UCC. Referral sources, I think some folks have talked about this. Schools, schools are a significant feeder to the UCCs. We want the schools to be, they are informed of it, but again, to highlight this access for them. Family themselves and kids themselves are utilizing this at about 24%. 16% of the referrals are coming from community providers. 6% or so from physicians and primary care folks that are interacting with the families and children in the community. And maybe 4% 211 and 2% or less from law enforcement. But again, that's another feeder system where in the past, sometimes if law enforcement for whatever reason is being called to an emergency, without having options other than perhaps referral to an emergency department, things can go in a different direction. So again, I sincerely appreciate the work that's done at the UCCs, the attention that's being paid to this important issue, and really the collaboration between the communities, the providers, families, children, schools that are trying to lift this up. And today's another step forward in that regard. And so we really thank you for your time and for being here today. And I think next I will turn it over to Deputy Commissioner Chantel Vars.
Thank you. Can you guys hear me? Good morning, everyone. So first I wanted to thank the Connecticut Children's Medical Center in the Village for hosting this important press conference and for their leadership in caring for children and families. As we observe Suicide Prevention Month and welcome the start of a new school year, we are reminded far too many young people are struggling. For too long, when a child is in crisis, the only place to go was the emergency department. While our ED partners do tremendous work, they are often overcrowded and not the best environment for a young person in distress. In 2024, nearly 39% of Connecticut patients waited more than 4 hours in a hospital, just for a hospital bed. We know that that's not a setting any parent wants for their child suffering during a mental health crisis. That is why urgent crisis centers are such a critical resource. They are often a calmer, more supportive environment designed specifically for children and families. Since July 2023, our 3 community UCCs have served over 2,500 youth and families. The results speak volumes. More than 99% of children met their treatment goals. And to echo what the DCF commissioner said, 95% were discharged safely back with supports in place. These centers don't just treat crisis in the moment. They link families to ongoing community resources, helping prevent repeat visits, and giving children a real path forward. And this work matters. Between 2017 and 2021, our state lost over 2,000 people to suicide. Behind each number is a child, a sibling, a classmate, a neighbor. UCCs are the most powerful tools we have to change that story by intervening early, preventing unnecessary ER visits, and ensuring families feel supported. So, as our students head back to school, our message is simple. No family has to face a mental health crisis alone. With UCCs, there is a better place to go. A place that is immediate, compassionate, and effective. On behalf of DSS, we want to thank CCMC for all of our partners for making this possible. The state of Connecticut has introduced more funding this year. In fiscal year 2026, we are providing $2 million in the fiscal year 2026 budget, and in fiscal year 2027, there's also been $1 million provided in that budget to help with this effort. Together, we are building a system that responds with humanity and urgency, and one that gives children a safe place to turn when they need it most. And so again, we really want to thank the Connecticut Children's Medical Center in the Village for bringing us all together today. Thank you.
Now I'd like to call up probably the best expert on what a UCC is, Lisa.
Hi, good morning. Thank you. My name's Lisa Paradis. My wife and I have a daughter. She's got some special needs. She's got a very complex background. She was adopted, and she has developmental delays. And unfortunately, when she becomes overwhelmed she becomes violent. She can have very violent outbreaks. We were really unsure what to do with this. As she got older, she's now in middle school, but as she got older and she got stronger, we just didn't know what to do. We were told at one point to go to the emergency room, and that was difficult. It was overcrowded. There was no place to sit. She became more dysregulated there. We were separated, and for a child with developmental difficulties, that was hard because she didn't really understand the questions or know how to answer them. She ended up spending the night there, and that was pretty traumatic for our family. It was the first time we'd been separated. She did get some services that she needed, and we were grateful. Afterwards, we started more counseling, and we were told about the Urgent Crisis Center. And I have to tell you, it's become our safe haven. My daughter, again, had some violent outbursts. We decided, let's try it out. I mean, what do we have to lose? We had no place else to go. We came in, and it was a completely different environment. It was cozy. Immediately, there was a receptionist there who said, "Hey, what's going on? How can we help you?" They were able to bring my daughter's levels way down. We were brought into a room. We could stay together, which was something that also didn't happen in the emergency room. We were able to stay together. I was able to support her. Granted, there have been times that we've come in and being separated was the best idea, and the staff were very quick to read that situation, separate her from, whoever brought her in, and get her calmed down. By coming here, we were able to get referrals that we were needed. Not only did we get these referrals, but there were follow-up calls like, "Hey, did you get there? Were you able to get that OT eval done? Or were you able to get the ICAPs in?" And that was really invaluable. Coming to a crisis center where it's more one-on-one, not only is your child being supported, but they're really looking out for the entire family. Speaking to other parents, I know parents who have children that are difficult, sometimes you feel alone. You feel like there's nobody else out there like you. They don't understand what you're going through or how difficult things can be. I'm telling you, if you have a question, if you think your child might need to be seen or evaluated, if you're just not sure, bring them down to the crisis center. They will take care of you. They will take care of your child. It's become our safe haven. I'd love to say that we never visit any longer, but we do. And that's just part of my daughter's history. And I believe we were here just maybe last week. And they are wonderful. She knows the environment. She knows, and she'll even tell me, "I think I need to go to the crisis center, Mom. I can't control it." And we come in, and sometimes she comes in kicking and screaming, and other times she comes in and immediately walking through those doors, she feels that calmness coming over her. Like I said, I can't speak more volumes for the Crisis Center. They've been our lifesaver, and they will continue to be our safe haven. And if you question that your child needs to be seen, please just come on down. You don't need to make an appointment, and they've been wonderful for us. Thank you.
Thank you. We do have a representative from Wellmore, one of our sister agencies. And now we can open up questions to the panel if there are any questions.
Dr. Rogers, I wanted to clarify the 2,500 number you gave. Is that just for
Dr. Rogers, come on.
children's? And are these all kids who came in because of suicidal ideations, or they had?
So that's all comers to the emergency department. So it's just our emergency department. We see about 60,000 kids a year in our emergency department. We screen universally starting at the age of 10. And so we identify about 2,500 kids, actually more, every year who have risk of suicide.
Okay, so, but they could have come in for a broken
Sprained ankle. Yep.
Thank you.
Sure.
And just so parents can be aware, what exactly does the screening look like?
So it's a simple 4 or 5 question screener. It's validated, meaning it's been proven to identify kids who are at risk for suicide, meaning it's not going to over-screen, which we don't want to do. We don't want to over-triage or over-screen kids and stigmatize things more. We want to identify kids who are truly at risk, which this screener works. It takes about 30 seconds to do. Our nursing staff has been doing it for about 5 years. We have about a 90+% compliance rate, meaning we've really changed the culture in our ED to include suicide screening. And I often hear them explaining to parents, well, we do this because suicide's the second leading cause of death in your child's age range, and we don't want your child to die by suicide. So we ask the questions that some parents may struggle asking. Sure.
Sorry, you also mentioned that, it doesn't increase risk to talk to your kid
Correct.
about suicide. Does the hospital have resources, or how should parents start that conversation?
So there's lots of ways to start it, but just asking direct questions is the best way to do that. Are you having thoughts about suicide? Plain and simple. And then having a conversation with your child. And if necessary, calling 988 to help direct next moves. But yes, research has shown that actually talking about suicide is protective against dying from suicide. So many kids feel those are bad thoughts. I'm not going to share them. But when asked, feel relief and a sense of hope when they're able to actually share those thoughts and realize that they're not alone. And so that's how we've changed culture in our ED. It's not very hard. Once you start asking and getting positive responses, it's pretty powerful. I've told this story a bunch of times, but we had an 11-year-old girl screen positive very early on in our screening program. And our provider went in to sort of confirm the risk, and then had the mom come in, explain that she was at risk for suicide. And the mom, very distraught, was upset and said to her daughter, is this true? And the daughter said yes. And again, this is an 11-year-old little girl. And the mom said, but I thought we were best friends. And the little girl said, we are best friends, Mommy. And she said, but best friends tell each other everything. And she said, yeah, we do. And the mom said, but how come you didn't tell me? And she simply looked back and said, well, you never asked. So that one gets me every time. And you could imagine having that unfold in front of you would make you want to ask those questions all the time. So we don't miss anybody. And if that's the one opportunity they get to sort of share their feelings or their thoughts, we want to be the ones to do it.
What are the signs for parents to know when to take their kid to the UCC or the emergency room? And is there a difference there?
Yeah, so I think, an emergency room is for emergencies, meaning if there is a child is hurt, requires medical attention, if your child is unable to maintain safety, and I actually mean that in a pretty extreme light, because here at the UCCs, we don't turn kids away. There's no reason that a kid might present that we might say, sorry, you're too acute for us to see you. So at the Urgent Crisis Center, we're accustomed to working with kids who have active thoughts of suicide. We're accustomed to working with kids who are actively dysregulated and need to have some support and help. We're set up to be able to be a calming space for those kids who are dysregulated. We're set up to be able to receive ambulances for youth. I think the only thing would be if your child has actually had done something to harm themselves that requires medical attention, absolutely go to the emergency department. The urgent crisis centers are open 7 days a week. During the evenings, meaning overnight after 11, before 7, they're not open. So that would be another indication to go to the emergency department instead of the urgent crisis centers if it can't wait until the morning.
And if a parent's ever unsure, because those are difficult decisions to make, am I going to call an ambulance and have my child go to an emergency department because I'm worried about her suicide risk? That's a hard thing to decide, right? And so calling 988 doesn't mean they're going to immediately send an ambulance to your house. They're going to talk to you. They're going to help you assess what's going on in your home, what's going on with your child, and help guide you on where you need to go next. And hopefully that's the UCCs where they can address problems in a nice, calm, safe environment.
As far as the start of school as kind of a trigger point, is that because more teachers are referring kids to UCCs? Is it because school is just stressful to start?
Yes and yes.
Okay.
Yeah. It's a lot more stress. All that peer pressure and everything else happens. Oh, sorry. Yeah, it's a lot more stress. We see volumes go up usually in mid to late September. They'll go up and down over vacation periods, and then drop way off in summertime. Not as much as it used to drop off, but yes, we assume it's increased stress, different, more pressured routines, and the pressure of school.
I'll just add, for every kid, whether they have a history of behavioral health issues or not, transition's hard, right? When there's a change in routine, when there's a change in like what happens in their day-to-day life, that's difficult, and that can cause a lot of anxiety. For some kids, they have more tools to be able to manage that and get through that period than others. So that alone is hard. On top of that, kids are facing sort of increased demands of maybe they have learning challenges, and having to face sitting with that and working through that's difficult. For other kids, it's the peer and the social interactions that can be incredibly challenging and difficult for them, and being able to navigate it. And the reason schools also send is because the kids are there the bulk of their day, 5 days out of the week. And so their first touch point is going to be that teacher, is going to be that school counselor, that guidance counselor, social worker. Many of our schools also have school-based clinics that are a real resource for kids to receive support. And there are times in which that support can be given within the school-based clinics, and other times in which it's just too great and there needs to be more help than what can be provided right there.
Have you put like a number on the increase in volume of need at the UCCs and the ED? Like with schools?
I don't know if you have an actual number.
I can give a rough idea. I would say we probably have at least a 50 to 75% increase during the school year. Summer months, our average daily census is about 22 kids. In the summer months, we usually have 10 to 20. In the winter months, we can have upwards of 30 plus.
Similarly, I think across behavioral health systems for children, that's the arc that always happens, is when school starts, spring break, and at the end of the school year are typically like peaks that happen for children. And so to give an actual number, it varies from year to year, but I think at the UCCs, as people are utilizing our services more and the word's getting out that this is an option, that we're starting to see more and more youth. But hopefully we'll continue to see an increased use so that we can start to balance out and get those kids who really need the emergency services, and those who need crisis support can come to the urgent crisis centers, which are in Waterbury, New London, and here in Hartford.